my name is Marika, sports physio from sportsinjuryphysio.com, where you can get online physiotherapy consultations via Skype. If you're new to the group, how these things work is if you've got any questions, just pop them in the comments. If you've got questions when you're watching this on replay, please feel free to just pop them in the comments and I'll get back to them. It works really well if you actually tag me in your comment, because then Facebook shows me that you've commented. Tonight's topic is all about how to deal with the mental part of being injured. And if you've got any ideas which you feel I haven't covered, then please let us know how you deal with that. I find that my patients tend to go through the same 5 stages that they describe for the normal grieving process when they go through injury. And these stages are basically denial, anger, bargaining, depression, which I'm going to call low mood, because let's face it, it's not true depression. And then finally, acceptance. Now, these stages are normal and all of these feelings are normal, and some people will feel more of one and more of the other. But the importance is that you don't let it get in your way of recovery. Okay. The other thing to notice is that it doesn't mean that you've got to go through denial and anger, blah, 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 before you get to acceptance. They all kind of merge into each other, and I find that people can often move from acceptance a little bit back into anger, back to acceptance, a little bit into a low mood, and that's quite normal as the process goes. But it helps if you've got people around you who can just reassure you and keep you on track with that. Okay, so let me just see. Excellent. Now, the first point is denial. Now, denial is very natural, and to be honest, it's also a little bit useful when it comes to injuries, because not all injuries needs to be treated by a physio or seen by a doctor. You remember last week's session that I chatted about how you can actually decide whether you should be training with a niggle or not. That can be really useful. So it's okay to kind of go, I'm not sure this is an injury that I should listen to, and just test it a bit. But don't stay in the denial phase for too long. Don't keep on training with pain and training into pain to the point where you turned a little niggle into a proper injury. Give it about a week or two, test it gently, and if it doesn't seem to be going away or it seems to be getting worse, go and seek some advice. I find if people come to me within that stage, I can often just tweak their training program rather than stop them training so that they can recover while they're keeping active. So yes, while denial can be useful, just don't stay there for very long. Now the second one, anger. I've not met many people who's not been annoyed with an injury, and that can range from just being fed up with it to being actually really, really angry about it. But the big thing is just don't beat yourself up about it too much. Yes, sure, we all make training mistakes. Yes, it may have been silly to do another round or another lap at that same pace, even though you felt something come on. But it's not the first time, and it won't be the last time that you do it either. The big importance is that you learn from these things. Because if you can then in the future apply what you've learned, you will avoid it actually. That moves me on to the bargaining stage. Now this is the stage that I actually dread but also enjoy. So most patients will want to know, when can I go back to running? When can I run? Can I still run? Please can I do the race in 2 days time even though I can't walk? So the bargaining stage of injury treatment can be a little bit annoying because people want to do things before they want to do it, but often also rewarding because there are things that you can be doing. Now, if you've listened to my talks before, you'll know that I'm a big proponent of relative rest. And relative rest is the perfect bargaining tool because it means that you only rest from the things that really, really aggravate your activity. And there's lots of research out there to show that that is a safe way of recovery and that it actually helps your recovery. If you just withdraw from all activity and you just think, right, I'm just going to rest, that doesn't actually do you any favors either, because you need a little bit of stimulation to get your injury stronger and keep your fitness there. So relative rest means that, say for instance you're a runner, we first of all see, can we just reduce your training to the point where you can actually keep on running but without aggravating it? And it may be things like the volume you're doing, or the speed you're running at, or the terrain you're running at, all of those things can often be tweaked to allow you to continue training. Now, if you can't continue training and you have to give up your sport that you do and do something else, it's really useful to sit and think about, why is it that I enjoy the sport that I'm doing so much? So what are your benefits? And I always think that it's a good idea to list the top 3 benefits. Now, to give you an example, when I was injured a few years back, I had an adductor tendinopathy, and I did the classic thing of denying it for too long and trying to train on it, and I gave myself a full-blown one where I had to stop training. So at that point, I was searching for something that would give me the same rush, because I love running, and I realized that I loved running because it really gets my heart rate up and it makes me work hard, but then it's over and done with. The second thing that I really love about running is that it gets me outside. I don't like running on a treadmill. In fact, I tend to nearly fall off them because I have no rhythm for them. I like being outside and getting the fresh air in and what nature gives me. And the 2 things that I found that ticked those boxes was, one, spinning, because it was sharp and short and over with, and because I had a spinning instructor, I could focus on something, so it wasn't like running on a treadmill. And the second was, I could still go for long walks over the downs, which meant that I got out there and I got my emotional fix that I needed from being outside. So if you are forced to bargain with yourself and do other activities, make sure that they tick the boxes. If you're going to force yourself to swim lap after lap after lap because you believe that's good for you, but you hate it, that's really not going to do anything for your mental strength. Let me just see if I'm missing out anything there. Yes, so that's what I would say with regards to bargaining. You can't always continue with exactly what you want to be doing, but there are ways that you can adapt things. And if you can't see how you can adapt things, it may be worth speaking to a sports physio or somebody, because they can help you look at it from a different angle, and also they understand the injuries, so they will know what you can still do that will allow the injury to heal. Then that brings me to the depression stage, or the very low mood stage. The problem with being injured, especially if it's an injury where you really can't train at the moment, it can really shake your faith in your body. It can produce thoughts and feelings like, I will never get better again. Especially if the injury lasts for a long time and you can't get a diagnosis for it, or you're struggling to get a diagnosis, because I know Julie is in the group is struggling with that at the moment. Then it's very easy to start thinking that you'll never get back to training. Now, the important thing, first of all, is to know that most people underestimate how long it takes to recover from an injury. A normal, simple muscle strain, which is one of the easiest things to come back from, takes at least 4 weeks before it's strong enough for you to do full training on. So that's a whole month just for a tiny muscle strain. And we're not talking about a proper muscle strain, which can sometimes take 12 weeks or longer. And the reason for this is, whenever you have an injury, the body first has to absorb the injured tissue, so it gets rid of all the cells that's been broken and stuff, and then it's got to slowly repair it. Now, the first fibers that gets laid down are not in the right format. It's not the right type of cell, or it's not as strong as they should be. So it needs several weeks to turn over these cells and make them stronger. And it does that in reaction to what you use as stimulation to get it stronger. So if you keep on training on it and push it too hard, then those fibers just break down and you don't get progress. If you do nothing, then the body just reckons, oh, it's strong enough, don't need to do anything about it. And again, it doesn't get strong. But if you just gently push it every now and again a little bit more than what you could do the previous time, then over time, you actually increase the strength of that injured body part and you heal yourself. So know that most sports injuries that I've seen do recover. Some of them just take a very, very long time, and it can take 2 years or longer. Now, the obvious thing from this is that it really helps if you've got a diagnosis. So if you feel that you're falling into despair, go see somebody who can help you get the diagnosis of your injury and understand what you need to do to get it better. And then thirdly, how long that will take. So for instance, if you come and see me with or you consult me for an ankle sprain or something, I can pretty much tell from how you present on that first day, the test movements I make you do, and also usually checking how quickly you recover in the first week, I can pretty much predict how long your recovery time is going to take. And that's because I've seen several people in the past with that type of injury. Now, the problem is, I will tell you that it's going to take about 4 weeks at least, or 6 weeks at least. But by week 2, you've already forgotten when you started counting. And you start going, but oh, it's taking forever. I don't think this is getting better. So make sure that you mark on a calendar when you injure yourself and how your recovery takes place. Because that brings me to the other important point, to actually keep a little bit of a diary week by week of things you can do. Because again, if you're a month down the line and you've still got pain, it's very easy to think this is not getting better. But then you forget that 4 weeks ago you couldn't even put weight on it and you had to use crutches, whereas now you can actually walk at a brisk pace. So that's a massive improvement. It's just not where you want to be yet. But it's actually recovering exactly at the rate that it should be recovering. So it's really important to map that time frame for you, and then also keep up to date with your small victories, I like to call them, and celebrate them. When you feel down, go and have a look. Where did I come from? What can I do now which I couldn't do last week or the week before? Because then that will reassure you that you are getting better. And that leads me into, what do you do if you don't actually have a diagnosis and nobody can figure out what your pain, where your pain's from or what's causing your pain? Now, first of all, if you come and see me and that is your situation, that you've seen loads of people, nobody can diagnose you, the main thing is I would want to rule out any serious injury. And it's quite easy to do, to rule out anything like cancers, inflammatory diseases, anything that we need people to act about quickly. And that's done via blood tests, it's done through scans and things. And usually when people have been struggling for more than a year to get a diagnosis, all of these things would have been done and come back negative. Now that doesn't mean that that pain is in your head. It may just mean that it's a type of injury that can't be picked up by the scans we have. And to be honest, you don't need a full-on diagnosis confirmed by a scan to get better. If you treat your injury according to the symptoms and how the symptoms react to your exercise and your strengthening stuff, then you can get an injury better without ever knowing exactly what the diagnosis was. I know this sounds weird, but honestly it does work. So if you've already ruled out all the nastiness, that the doctors have done all of those tests, and you're sure there's nothing like that going on, and you're in that limbo of not knowing what my diagnosis is, and I can't do my full training, find somebody who can help you establish a baseline where you can start training from, and it may not be the sport you want to do, but it's got to be some sort of activity or strengthening depending on what it is. And then just incrementally work on that. Honestly, you don't need a diagnosis for injuries to get better. You just need to understand where that baseline is where you start and then slowly improve on that. Now the last stage is acceptance. And acceptance is a wonderful stage for patients to be in, and my job as a physio is a really easy job when people come in and they've accepted that they're injured and they've accepted that they would have to make a few changes to their training and stuff, and they're ready to listen to what I've got to say. Now, that's the obvious bit about acceptance. The other bit I want to highlight is that acceptance is also about actually having faith in your body and accepting that it will get better. It's about accepting that you will be able to run fast again, even though you can't do it now, even though you may have to run at an annoyingly slow pace. Accepting that you will be able to do everything if you just take it slowly enough to return to these sports at the pace that it needs returning to. Now, I've got so many examples of people in the past where they've said, I'll never be able to do this, or I'll never be able to do that. And I listen to them and I go, okay, fine. And I just work on getting that pain better for now. And the number of times they come back in a year or so from now, after having sworn off running a year ago, saying they will never do that again, and then go, I'm training for my half marathon, I've got this and this niggle. And you go, oh, that's interesting, because last time I saw you, I understood that you would never run again. The point is, when you're in that dark, deep moment of being injured, it's really hard to see a way out. But injuries always gets better. It's just about taking the time to actually give them the rest or recovery time that they need. Some needs a very little, some need quite a bit. But if you've got somebody to help guide you there, it can be really useful. So let me just see if we've got any questions coming through so far. Okay, no, I think I've answered those ones. So if I can recap for you, the 5 stages of crisis that I see people go through when they're injured is denial, anger, bargaining, mental or depression or low mood, I should say, and acceptance. Now, denial is useful. Don't always feel you need to run to the physio. Gently test it first, and if you want to know how to carefully test it, check out my blog post that I wrote last week. That explains to you how to do it. Anger is okay. It's fine to be angry. We all get angry when we're injured because it's just not fair, is it? But learn from it so that you can actually apply those things that you learn from this situation in the future. Then bargaining, remember relative rest. It's a very good bargaining tool, and if you apply it right, you can usually keep your fitness while you recover. And then to help with the mental side of it, where you feel low mood, make sure you get a diagnosis, see somebody who can help you understand how long this injury is going to take to get better, then map your progress as you go along so that you can see the small improvements that you make and celebrate those successes. If you can't get a diagnosis, find somebody who can help you work with the situation you're in so that you can improve that little by little. Okay, you don't need a diagnosis to recover from a sports injury. You just need to respect the symptoms and work with that. And then lastly, acceptance. But remember, it's also about accepting that your body will heal itself. You've just got to give it the right combination of things. Well, that's my story for tonight. Let me just make sure that we've covered all of that. If you need any help with any injuries, you can consult me via Skype. I've put a link in the comments. But if you've got any questions or you've got any comments of your own, pop them in the comments or just feel free to contact me on Facebook. Take care, guys. Thank you for watching. If you would like to learn more about preventing sports injuries, make sure you hit the subscribe button. See you next time.